Hi, I'm Dr. Shah. I'm a epilepsy specialist and chief of neurology at Carilion Clinic, Virginia Tech's Carilion School of Medicine in Roanoke. We are going to talk about some issues related to teenage and epilepsy.
Hi, my name is Izzy Gregory. I'm 18 years old and I live in Fredericksburg, Virginia. I'm a senior at Chancellor High School, and I'm also an athlete for travel soccer and hockey, and I also play for the school as well.
Teenage usually brings a lot of changes in life, so we have to deal with those. One of the most important thing is transition from being a child to adult. So sometimes changing a neurologist or a provider who's seeing you in a pediatric aspect of things to moving into adults. So that coordination obviously is important. Most important thing is for clinicians and family to talk to the current provider and the future provider and make sure that the information is exchanged.
I've had seizures since I was 3 years old, and because mine take place in the frontal lobe, they're presented different than everyone else's. They're more fear related and they happen towards the night. I have about 30 to 50 every single night, and I wasn't exactly diagnosed until I was 6 years old because we went through 9 different doctors. I used to be at UVA Hospital, and I'm now at Nationals in DC. I've had 15 failed medications, and I'm still trying to find the right one, which hopefully will happen soon. I've had 2 surgeries, an SEEG, and lots of regular EEGs.
You are going to have other aspect of life putting some demands on you, such as meeting with the friends, staying up late, either studying or hanging out with friends. Sometimes alcohol or drug becomes an issue. So a few things regarding seizure safety, that if you have seizures, there are 3 things which may precipitate seizures, meaning that they don't necessarily cause seizures, but if you have seizures, those situations will make you more likely to have seizures. Those 3 things are sleep deprivation, alcohol consumption, and medication non-compliance. So if you stayed up late, you are more likely to have seizures next day. If you stayed up and had a party and had a few drinks, you are even more likely. And if you missed your medication dose because of that, you are triple likely to have seizure next day. All those things are important: avoiding alcohol, avoiding sleep deprivation, especially prolonged sleep deprivation, and adhering to the medication the way it is prescribed. If you are going to be driving, you need to follow the rules. Each state may have a separate rules regarding driving when somebody is suffering from seizures. In Virginia, you can drive if your seizures are under complete control for at least 6 months. So if you're seizure-free for 6 months, you should be able to obtain driver's license or the permit and drive. Sometimes DMV will ask you to get the forms completed by your physician. Again, be truthful. The reason the restriction exists for driving is not to punish you, is to protect you and the general public at large if you end up having a seizure behind the wheels. Most people who get hurt while driving are the person who is having seizures, not the others. But it's possible that you injure somebody else because you had a seizure. So it is important to talk about that. Make sure that if you have had alcohol or sleep deprivation and you're more likely to have seizures, to try to avoid driving in that situation. And always, always take your medication.
School has never really been hard except for like memorization because of the lack of sleep. But just in case something does happen at school, my school gave me a little red card that I can pull out of my backpack and just show it to my teacher and leave the room in case I need some time to shake it off.
So having a calm discussion about it ahead of time always beats frantic trying to figure it out what to do at the time. You may want to talk about your seizure specifically and general seizure safety issues, such as if you have a seizure, what to do, put you down close to the floor if it is a generalized tonic-clonic seizure, is to avoid injury, turn you to the side, not to stick anything in the mouth at the time of having seizure. And if you don't wake up or your seizure is prolonged, to call EMS for help, and then ultimately contact your parent or other adult to know what would be the best step possible. You should get in touch with your physician, make sure that your medications are available at local pharmacy, and all those things, which is obviously going to be important. Having emergency contact with your parents is again important. You should also let your counselor and school know, including your teachers, especially if your seizures are more frequent.
People always ask me how I play sports in my conditions, considering I'm always tired. But for me, I feel like sports are like my getaway and my happy place, and it makes me not think about it as much when I play sports. So I think that's the one thing that really drives me to do better in those types of things.
So one other important thing is to discuss your condition with your friends, and if you're playing sports, especially team sports, to talk to your coach and your teammates. Seizures can happen at any time, so obviously you not telling them doesn't necessarily help the situation. If they know about it and they know what to look for and how to help you if you end up having seizure, is always more helpful than trying to scramble again at the last moment. So my advice would be for you to discuss this with your friend openly, that this is not something which just comes upon you. You have a condition, and this is a manifestation of that condition. It is controllable with medication like any other medical condition, and you just need to be taking medication, but sometimes you may still have it even on medication. But if it happens, this is what is likely to happen to you, and this is how you take care of it.
Telling my teammates wasn't as hard as I thought it was going to be. I was nervous because I wasn't sure how they're going to react, and I didn't want them to treat me different. But they were all very supportive of me, and they were always there for me, asking me how I was doing all the time, making me feel good. The first time I actually told them was at a state field hockey game, and I wasn't able to stay in a room with a few of my friends because of my sleep, and I didn't want to wake them up, so I had to sleep in a different hotel room than they did, which really sucked, but I knew that it would be good for them and me in that situation.
It is awkward to approach subject of personal medical illness, but again, hiding from it is usually not the good strategy in the long run. You may not want to talk on the first date, but if you are dating somebody on a more longer term, then you should talk about your health issues. So if they don't, again, freak out, if you end up having seizure in presence of your date, and also educate that person what seizure means to you, what it does to you, how to take care of you at the time, and how to get help. What medications you are taking, so they don't feel that you are using drugs. If you just they find you taking a pill, they know that you have a medical condition and you're taking medication instead of somebody assuming that you are abusing drugs.
Friendship-wise, it's always been easy to tell my friends and my past boyfriend because they were all like very supportive of me. Their reaction wasn't bad. It was good. They gave me a hug, and they told me that they were going to be there for me. My past boyfriend actually witnessed me having a seizure, and he reacted as if he was getting hurt as well because he saw me in pain. So that was good in a way.
If you're a girl, you may want to familiarize yourself with the interaction of birth control if you're going to use especially hormonal like pills or other hormonal methods to prevent pregnancy. Some of the seizure medication may be interacting with those hormones or hormone replacements, and there are issues if you become pregnant while taking medication. Not every medication is safe to be taken during pregnancy, and those needs to be planned. Having seizure is obviously not good for pregnancy either. So in every case, we usually recommend someone to continue to take medication during pregnancy, but you may want to switch to a different medication which has a less effect on developing baby versus some which may have more effect. So those discussion needs to happen before you get pregnant with the provider who is prescribing you the medication. So again, it is important to know what your options are, what could be interaction of medications, what could be the effect of medication on the pregnancy, what could be the effects of pregnancy in your seizures. All those things should be discussed ahead of time. So it is, again, nothing to hide from, but needs to be discussed. The reason I keep saying that it needs to be discussed ahead of time, because more than half of the pregnancies in the United States are not planned. So pregnancy just do happen, and you don't want to be scrambling about the decision what you want to do after you know that you are pregnant. Those decisions needs to be made ahead of time. Be proactive regarding your own health. Certain careers are more suitable if you have uncontrolled seizures. Seizure per se should not prevent you from going into any career. There are a few exceptions. Perhaps you will never obtain a pilot license if you have a history of seizures. You may have restriction on driving commercially. You may not join Air Force or become a fighter pilot or something like that. I'm not sure. Every profession I know the restriction, but you have to look into those aspects of things where diagnosis of epilepsy may exclude you from those. Other than that, most of the careers should be fine for most people with epilepsy. Again, it's an individual case by case, how bad your seizures are, what kind of seizures you have, what kind of career you're looking for. In general, having lack of sleep or changing schedules may make seizures worse. So you may want to avoid those kind of situations where you have to change shifts often, because that may make your seizure control a little tricky.
My future plans are to go to Roanoke College to play field hockey, and I will be telling my team because I think they deserve it in that they're going to be playing with me, so they should know what's going on just in case.
If you are joining a college and you had to move away from home, so that becomes another point where things could be stressful. For example, if you're moving in a dorm, you have a roommate, what to talk about when you are meeting the roommate for the first time about your seizures. It is always important that you disclose the information and talk about it openly before other person may find out if you end up having a seizure. So it is important to educate the person that what your seizures look like and what to do if you have a seizure.
Me and my mom are working on a support group for other people like me, because I know it feels like you're isolated sometimes in the situation, and no one really knows what it's like. A lot of people, when they say that they're tired, I'm tired too, and they're yeah, it really sucks. They don't understand the type of tired that I have and they have, and not even the doctors really understand because they're not going through it like we are. So thank you for giving me this opportunity, and it was nice talking with you guys.
Overall, as a teenager, you have a lot of things on your plate. Epilepsy diagnosis and treatment of that is not going to make it easier for you. Generally speaking, talking about it and planning ahead of time will go a long way. So just be proactive instead of trying to hide from it. And that would be the most important aspect of your care, and transitioning slowly but safely from being a child to becoming independent adult.